this is Gianna. I am a news anchor, sports reporter, and TV and events host. And I'm back here at CSA Medical Aesthetics after a year to get my eye lift. So I was actually here last year with Doc Contessa. I've been going to her for the past few years, but last year specifically for my eye lift, because working in front of the camera, it's really important for me to always look alert, to always look fresh, and a little bit sophisticated as well with my line of work. Naturally, medyo droopy talaga yung eyes ko. And even though I've learned to embrace that, mahalaga pa rin para sa akin na lagi akong mukhang gising, and I'm really putting my best foot forward, not just through my work, but also through how I look, because I do work in front of the camera. Kaya excited na ako for an update on my eye lift today. And I'm just excited to see how it looks, of course, as I'm getting older as well. Parang nag-iiba na rin yung look ko. My facial structure has been changing too, so it's going to be really exciting to see how Doc Contessa is just going to uplift and upgrade how I look when I'm working. So to everybody watching, don't forget to click the subscribe button and the notification bell for more updates.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome back Gianna Llanes.
Hello!
Yeah, welcome back.
Thank you, po. Thank you.
A year ago, we did the so-called fax eye tread lift. More than a year ago, right?
More than a year ago.
Yeah. And I'm assessing Gianna right now. It seems like she needs now a kind of booster or like a touch-up treatment of that so-called fax eye tread lift. How was it during that like more than 12 months?
It was okay, actually. I said in my intro video earlier, my eyes are naturally droopy po. But even throughout that year that we did it, I still noticed a lift. So this is just a little bit of a boost.
Yeah. Because considering that the PDO, they last 12 months actually, they get hydrolyzed. We call it hydrolysis or the absorption of the PDO threads. Usually it starts from the 6 months to the 12 months. Okay. But then the build-up of connective tissue, fibrous proteins like your collagen, elastin, they happen during that time period. So like 3 months to 6 months, even more than that, you're developing these fibrous proteins to kind of sustain that lifting effect. Okay, and it's good to kind of boost the treatment that you've done a year ago. Because you know, aging is continuous.
Yes.
And we lose collagen 1 to 1.5% per year. And they were saying like mid-20s, 25. When you're 25 years old, there's already 10% collagen depletion.
Okay.
And 50s and above, like me, it could be 50% collagen depletion. Okay. That's why we have to do something to regenerate the collagen or replenish the collagen. So we're gradually aging. I could say like daily basis, okay. Or the others are saying on a yearly basis, okay. That's why now we'll be doing the so-called fax eye tread lift again. Now, I'm also assessing the upper third of Gianna. I noticed on the temple area, there's this so-called hollowness. So we wanted to also, you know, restore the volume on the temple region. And the way to do that is a volumizer called our hyaluronic filler. Now, on the forehead, we did a week ago 1 ml of our low molecular weight dermal filler to fill in the inferior part of the forehead area. So this is actually also a follow-up on that one, because usually when we do fillers, particularly on the forehead, we need a like a 1 week to 2 week follow-up to check, to also make it symmetrical, you know, because especially the forehead region, because we have bony ridges there, irregularities there. So after doing a procedure, we really need to check again because the filler can go into areas that will also follow your own natural bone prominence. So we'll do a touch-up of that one. So we'll show you the actual procedure when we return. And we're back. So we are with Gianna here, and together with us for the first time, Dr. Eric Wong.
Thank you so much for having me.
Yes.
It's an absolute pleasure to work, to see you, Dr. Contessa, in the flesh doing your absolute craft.
The pleasure, the honor is ours. Actually, he was only watching YouTube videos. Now he's in our YouTube video. Dr. Eric Wong is from New York, and he's a practicing.
So I am a practicing internal medicine physician. I graduated from New York University School of Medicine, and I'm board certified by the American Board of Internal Medicine and Obesity Medicine, which
That's
is
a lot.
Really, and I'm trying to start I'm in the process. I have a wellness practice, Icon Wellness, and it's a pleasure to be here. Thank you so much for having me, Dr. Contessa.
So Dr. Eric, Gianna is with us here. We've done a procedure a year ago, the so-called fox eye thread lift, the PDO thread lifting, a non-surgical method of, lifting the corner of the eye because as we age, it gets droopy. But she's still young. How young are you, Gianna?
I'm 30. I turned 30 a few
And I was
months
telling
ago.
her aging starts at 25 already. Whereby we already have collagen depletion by that
Well, she
time.
looks amazing. Thank
She
you.
is. And she's maintaining, doing treatments, non-surgical procedure. And now she looks so young, fresh all the time. Okay, so the treatment that we will do, again, this is like a booster treatment that we've done a year ago. And I will also be doing a correction of the volume loss on her temple, plus also a follow-up on the forehead filler we've done a week ago. Okay, so Doc Eric, what do you think of the treatments like this?
I know that the fox eye treatments, they're very popular nowadays. I know a lot of celebrities, especially in the United States, there's quite a bunch of individuals who are getting them. So I think it's a new trend.
Yeah, and PDO thread lifting is also famous in the States right now.
I think right now, after the advent of a lot of the obesity medicines, people are getting a lot of skin laxity.
Laxity, yes.
And these medications are very new. I think they're wonderful. I think they have had a significant benefit in not just the aesthetic space, but they have significant health benefits too.
Right.
And in the future, we're going to see more and more of these. However, sometimes if we lose weight too precipitously, we might get some skin laxity, and that needs to be addressed.
Right.
And nowadays, a lot of really good modality for treating that is actually PDO threads, polydioxyamine threads.
Because it's a collagen biostimulator.
Yeah. And it also has an immediate lifting effect, which it directly addresses the basically contour changes that you face when you have significant weight loss.
I call that Ozempic treatment giving that so-called acquired volume loss,
Yes.
There's aging causing volume loss, but that one is Ozempic treatment causing volume loss and sagginess. So right now there's I'm seeing celebrities in the US having this so-called Ozempic face.
Well, never before did we have such a powerful, pharmaceutical modality for these types of, for addressing this particular issue. Never before have we ever had any medications that are that powerful in inducing weight loss. So I think we're entering new territory.
Yep, and it's gonna be like in the coming years, there's gonna be an increase in the use of that kind of management.
It's an irrevocable wave. It's beneficial. I'm a big proponent of. I think these medicines are they're going to help a lot of people.
They will.
It's got cardiovascular
especially
benefits.
in the United States.
Absolutely. I mean, we have tirzepatide in the United States.
Yeah, we don't have that tirzepatide here.
It will definitely be coming. It's already approved in India, China. I'm sure it's going to going to South Korea soon, and it'll be here in the Philippines before you know it.
We're waiting for it, right? But you don't need that, Gianna.
She doesn't need it.
You're so physically fit. What's your secret, Gianna?
I still teach classes. I teach spin. I teach boxing, Legree.
There you go.
I work out a lot.
There
You know,
go.
Gianna, the thing about Ozempic, and I think that's great that you do a lot of fitness, is that when you lose weight in such a fashion, there is actually a lot of muscle loss. And actually, when you lose weight with these medications, it's actually even more important to be physically fit, to
Correct.
do a lot of fitness and focus on weight resistance training and things of that nature. Because it's not just about like weight loss. It's all about wellness, about taking care of your entire body, and actually fitness and nutrition become an even more significant and important part of your daily life when you have these types of medicines. And
Living
it's
a
great that we
balanced
have great influencers that are really focused on that fitness element.
Yep.
You know.
So Gianna doesn't have that so-called Ozempic face.
No.
Okay. It's just that, well, she's already slim, physically fit. I mentioned about volume loss, so I'll be using hyaluronic material to restore the volume. I already made markings. So for the temple area, the markings, you have your superior line, your temple fusion crest, and then this one, the medial line, following your lateral orbital rim, and inferior line, the superior border of your zygomatic arch, and posterior line will be your temple hairline. Okay, so I already made a marking of the injection point. Okay, so I'm just gonna be using 0.5 ml of my hyaluronic filler and do the so-called bolus technique, bolus injection. So this is gauge 27. Disinfect these. So I'll follow the injection point here. Okay, so this is on the supraperiosteal area. I'm already onto the bone. It's already bone instantly, so you need restoration of volume here. So this is a high molecular weight, high G prime product, and then we'll just do a bolus shot of our filler, 0.5 ml. So this is very viscous, so when you push it, it's kind of like there's a resistance to the, pushing of the material. So high extrusion force. And the needle is gauge 27. And this one will also help in lifting the corner of the eye. And Gianna will just need to hydrate, drink a lot of water because this is very hydrophilic. So it can attract water 1,000 times and it's going to restore volume. There you go. So I already saw an instant kind of elevation of the skin here. Now the next thing that I'm going to do is work on the forehead area. So we know that the forehead region is like it's a thin tissue area, okay? So we want a low molecular weight filler, a thin filler to work on thin tissue layer. Then I have the kind of like a poker here, and I'm using a gauge 23 cannula. Actually, this is new. This poker, we don't need to remove it. Like you can just insert it there and glide it towards the deep layer. So we go to the supraperiosteal layer. So I'm just gonna improve the tissue space here. I'm reaching already the center, so I made the marking. So actually the technique is so-called fanning technique here. Just glide like that. So see how it helped the doctor? Because in the past, we poke the skin and then you don't see the hole. So right now, it's a good thing that we have this material. So I'm just filling in using this cannula method. Okay, you're still good?
Yes.
Yeah. So the filler has lidocaine also. So somehow we are alleviating any discomfort because of the lidocaine. So just a small amount, small aliquot. Okay. Supraperiosteal here. So we want to improve the hollowness in the inferior portion of the forehead area. Just be careful with your supratrochlear, supraorbital structures. Okay, just a small amount because this is just a touch up of what we did last time. And then we'll proceed with the fox eye thread lift. So I also made markings of my entry points. So I do the so-called reverse technique, reverse method. So I'll start with the lateral canthal area here. This is just lidocaine. And then we're just gonna infuse or inject this tumescent lidocaine into the subdermal area. So you want to numb the region so that the procedure will not be, be painful for Gianna. Okay, she's used to it already, right, Gianna?
Yeah.
So we're just gliding it. You want to go in the subcutaneous plane above your superficial temporal fascia. Okay. because your superficial temporal fascia has your superficial temporal artery. Then a second one. So I usually start with 3 cog threads here. So this is the so-called reverse cog lifting. Because we also have the other, like the traditional or the classic cog lifting. You start with the hairline area. We can do that too, but I highly recommend this for the fox eye procedure. Okay. So I'm using a spiral cog with 60 millimeter length of this cannula. And then after this one, we'll go to the third one. So the goal is to lift the droopy, the saggy eyelid there. Okay. I think PDO threads started in the States before the pandemic time, right?
Yeah, I believe they're made out of the same type of material as surgical sutures.
Surgical sutures, exactly.
So.
And these surgical sutures, they've been there, we've been using them for a very long period
They've been there
of time.
for time immemorial.
Yeah.
And they're essentially completely resorbable.
Exactly.
But they have that element where they can help induce the fibroblasts.
Fibroblasts, exactly.
To lay down collagen.
Correct.
And thicken skin.
There you go. The mechanism of action explained by our specialist here. So we'll be doing this maneuver. Then we're done with the right side of the face.
Yay.
Wow, great procedure, great patient, great Dr. Eric Wong discussing and explaining. Okay, so let's now proceed to the opposite side. non-fox eye thread lift, the temple filler, also the forehead filler. We'll show the result when we return. And we're back, so let's show the result to Gianna. Gianna, mirror. Just look at it for now.
Wow.
Okay. So we have actually an instant lift on the so-called fox eye thread lift. So fox eye is pulling the corner of the eyes towards the lateral aspect of the face, the temple region. It's different whenever we're doing the brow thread lift, which is a vertical approach. This is more of like a horizontal vector. Now with the temple filler, we already have seen an instant kind of like a volume restoration already. There's already fullness of the temple. Now with the forehead, because I've mentioned that the forehead has irregularities, you know, the forehead bone, the bone ridges, irregularities there, and then we'll wait for the filler to still settle in, plus it will still absorb water. It's very hydrophilic, so it will attract water and it will still kind of plump up, volumize, and more forehead projection. How are you, Gianna?
I can't stop looking at it. I love it.
Yeah, the shape of the eyebrow. Okay, women, we want our eyebrows to be high arch.
Yes.
Men, like Dr. Eric,
No, we not
straight,
want-
horizontal.
Would not want a spot.
Of course, of course. So for men, it's different. It's a straight eyebrow, horizontal like that. And it's for men, it's kind of like when you have these droopy eyes. Some are saying it's cute eyes.
Yeah, I mean,
Like for you.
you don't want to like have like obviously like you just want to kind of have like some kind of brow ridge, but yeah.
It's fine, right?
Exactly.
As long as it's like good and harmonious. There's
Harmonious.
facial harmony there, and I like looking at Gianna right now. Her eyebrow is it's really blending with the beautiful face, the contoured face. Okay. So for the forehead, you can still do some massaging there, and we'll still follow her up, check her up after a week to again work on this forehead region. Okay. Because, you know, genetically speaking, you've mentioned about like in your family, it runs in your family, having this kind of like a hollowness on the forehead region and even on the sides, the temple area, right?
Yes.
So, like, it's a gradual procedure that we do also here, and plus we place the dermal filler in the deep layer, in the deep plane. We want that filler to push those soft tissues above it to improve really the forehead projection. For women, we want that convex forehead.
See,
Barbie forehead.
Dr. Contessa, see, this is why I came across the ocean for you.
Okay.
The way you explain things is just fantastic.
Plus the thing is, you know, here in Asia, this is the thing. This is what people want in Asia. But when you go to United States or even Canada, right, it could be different also. In every region, they have kind of like a different interpretation of what is beautiful.
Yeah.
Different
Very
beauty
contextual.
standards. Exactly, right?
Very
Like here,
contextual.
Filipinos, they want white skin. In US, in Canada, they want the
They want
tan
it,
skin,
They
right?
go to the tanning salon.
So it depends also in the region where
That's
you're
true.
in. Oh, but the thing is, this one, the droopy eyelid, of even the, you know, in the US, they also want to lift those droopy eyelids. So that's the goal. Plus, at the same time, prevention of aging. So we want to delay the aging. We want to prevent it. If you're not doing anything, it will just kind of go down, sag down. And if you're doing a prevention, you're maintaining your look at your 20s, 30s.
Now 30.
Yeah. So you want to stay in that look of a 30-year-old woman. There you go.
Yay. Thank you. Thanks, Doc.
Feeling more confident and
Yes.
you
I
know,
love it.
beautiful inside and out.
Yes.
Thank you,
Yay.
Gianna.
Thank you, Doc.
Thank you. Thank you, Dr. Eric.
Thanks, Doc Eric.
Thank you, Gianna, for letting me witness
Yeah.
Of course, of course.
you.
Thank
You look amazing.
Anything you want to share to our audience?
Well, thank you so much again to CSA Medical Aesthetics. I guess if you want to check out what I'm doing, it's my social media is all at Gianna Llanes.
Yeah. And Doc Eric, anything? Any message to them?
Well, you know, so my practice is called Icon Wellness, and I hope it's going to be up and running soon. And my Instagram is Eric Allen Wong, MD. But you know, thank you so much for having me, Dr. Contessa.
Thank you. See you again. Okay, if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Marugol, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And please do watch our other videos. Diana had how many? I forgot already.
A few already,
Okay,
yeah,
a
for
few,
years.
So you can watch her transformation, a very natural transformation. So thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.